My name is Nehad Fattah. I've been working with the Healings Across the Divide for 2.5 years now as the West Bank representative. I am a Palestinian American who moved to Ramallah 17 years ago, and I'm married with 3 children.
And I am Patrick Levy. I was born in France and I moved to Israel 34 years ago. I'm living in the north of Israel with my partner, and I'm representing Healing Across the Divide in Israel.
When people think about existing divides, they generally think about Israeli Jews versus Palestinians. What are some of the other marginalized populations that Healing Across the Divide serves?
So Israel is really a melting pot of numerous populations, Jews and non-Jews, ultra-Orthodox Jewish people and secular people, people who were born in Israel and people who came to Israel from all over the world. So the divides are actually beginning within the border of Israel, and very often we have these people. All these people are living one nearby the other, but they are not living together. And our work at Healing Across the Divides is also to try to bridge the gap between these different populations, so that they understand that despite the differences, there are a lot of similarities regarding the subjects and the issues that they have to deal with, and also the creativity of their responses.
Can you talk about who some of those other populations are, such as African asylum seekers, Bedouins, other populations?
Sure. So our projects within Israel are very diverse. We have right now a project regarding violence towards women within the Bedouin community in the Negev, in the south of Israel. We have a project regarding sexuality for adolescents who are Jewish, coming from Ethiopian origin, living in the center of Israel. We have a program regarding safe homes within the Palestinian population living in Israel, and also within the ultra-Orthodox population, Jewish population. So these are only a few of the different projects that we are supporting or we've been supporting throughout the years.
And on the West Bank side, we work with women, obviously. I mean, and not just, when I think Palestinian Israeli, I think for some reason men and youth, and that's not what this is also about. We also serve women and elderly, and so we have programs that are reaching out to these marginalized people and youth. You know, there's a drug prevention program that we're currently working with that helps teach children and their parents how to avoid the use of alcohol and drugs and smoking in the West Bank.
It sounds a lot like public health interventions that we do in the United States, that you do on targeted vulnerable populations, youth, older adults, people with chronic health conditions.
Exactly.
What are the opportunities and challenges of working in such a charged political environment, even as a non-political organization? And how do your respective political leaders view the work of Healing Across the Divides?
I'm assuming our political leaders are okay with Healings Across the Divides. The West Bank and Palestine is a very donor-dependent country or state, and so I think any help that we can get is viewed from our political leaders as something that is obviously useful. Some of the challenges that we have is trying to get our grantees together because of border issues and because of permit issues that have to be issued through the Israelis. So that's where some of our, for me at least, some of the challenges are. There's also some challenge in reaching marginalized groups. For example, some women in certain areas who would be interested in becoming involved in a program that we're implementing, but because of cultural reasons or border issues, they aren't able to engage with us.
Mm-hmm. And within Israel, I'm not sure that our political leaders are aware of us because, because we are a very small organization, and B, because we are working and creating a platform for the community-based organizations to be in front and really to show what they are doing and what are their assets. People at the Ministry of Health, for example, in Israel, are looking at us as an instrument for these communities to be stronger and to deal with health issues. Eventually, as Nehad was saying, when we are meeting Palestinian and Israeli grantees are meeting together, that's where we feel that walls are breaking down because they do understand that behind their differences they have a lot of things to fight in common, and that's something which is quite amazing.
And that is some of the peace building work that
Exactly.
Across the Divides does.
Yeah, Healing Across the Divides is not a political organization with a big P. It's a community-based effort, and it's about saving lives, and it's about understanding that life matters, wherever you are. If you are black or white or Muslim or Jewish or Christian. And that's what matters to Healing Across the Divides at the end of the day.
Well, I remember when I took my first trip with Healing Across the Divides, that it was such a revelation to see, oh, you're doing public health interventions. That's what we advocate for in Ohio.
Yeah. And that's what we advocate for in the West Bank and in Palestine. Because there are political issues and political constraints, sometimes who gets lost in this? It's the marginalized people. It's people who don't have a voice. And this is why this organization, HATD, is amazing, because we help target and we look for these people so that we can help them, because they can be forgotten, especially in the current context. And
health right is by definition the basic right. If you don't have the right to live, and if you don't have the tool just to have a healthy lifestyle, then it will be very difficult for you to fight for other rights and to live one needs the other, because there will always be life-threatening difficulties that you have to handle and to fight for.
And you mentioned that it's a small organization, so it's not necessarily on the radar of political leaders. On the other hand, a number of your projects on this invisible organization have been taken up by large entities. Can you talk about that?
Yeah, in Israel just now, as we speak, one of our projects has been receiving the prize for welfare and social innovation in Israel, and they are going to the parliament, to the Knesset. Grandmothers, Palestinian grandmothers, are going to receive this prize for what they are doing for their children and grandchildren. And this project, which has been launched and supported by Healing Across the Divides, is now duplicated to Jewish and other populations within Israel and also outside of Israel. So it's very exciting to see that our very small actions and small funding can lead to sustainable impact. That's something which is amazing.
And on the Palestinian side?
So we're working with a group called Al Maqdisi, who does drug prevention for children between the ages of 12 and 14. And the CEO of the program, Norbert Goldfield, has brought in professionals from outside who volunteered their time to give them training of a program called the Unplugged program. It's a 12-step drug prevention program that involves children and their parents. The Ministry of Education in East Jerusalem has adopted the program, and we trained a trainer program for 11 counselors who are now doing the programs in 11 schools. So, and we're hoping to expand this, and there's people in Hebron now who are asking. There's West Bank, the Ministry of Education in the West Bank is also exploring ways to also continue to do this. So there's a sustainability factor with this program and that program, and that's kind of what our motto is. We're not just in it to just give money. We'd like to see growth. We'd like to see capacity building. We'd like to see these things stay sustainable within the organization, and that's the impact for us.
So our relatively small donations can really get a giant bang for our buck.
Yes. I mean, that's just some of the things we're talking about, but we offer a lot for very little, which is great. And people go with it, and our grantees go with the money that we give them and make something out of it. And I feel very proud to be part of this organization.
Yeah.
Yes. When I was working on health improvement among older adults and people with chronic diseases in the United States, many advocates around the country looked at the Stanford chronic disease self-management program as a model for many reasons. Now you're taking it to the West Bank.
Yes, we have three of our current grantees receive training through Norbert Goldfield to do the Stanford program, and so which incorporates both health, exercise, and psychosocial factors into helping people live better, healthy lives, educating people about what that means. And in some cases, it would be nice for people with chronic disease to eventually get off their medication, but that's not what we do. We just teach you, or we teach people with diabetes or obesity how to try and maintain and be healthy. And the success has been tremendous. We've reached over 1,000 people who have taken part in this program, so it's great.
And it's especially exciting to be doing that in an area where there's not a lot of health care infrastructure.
Yep, exactly, yes.
That people learn to do self-management
Yeah.
of their health. Thank you.
You're welcome.
Welcome.